The diagnostic process in Chinese medicine. Today, we explore the structured diagnostic approach in Chinese medicine from initial contact to treatment outcomes. The diagnostic process is critical, no, in healthcare, serving as a systematic journey from identifying a patient's issue to achieving resolution. So from the time you see the patient, you need, this is the most critical part until you are able to resolve the problem. By employing a structured methodology, we can effectively gather information, form hypotheses, and validate their assumptions, ensuring comprehensive care and improved patient outcomes. Okay, let's now try to understand the journey from problem to solution. So we have point A. This is where the patient presents with a problem. So the diagnostic process begins already when the patient first presents a problem. So we refer to this as point A. This is a starting point for all interactions and initial assessments. Okay, point B, the patient is no longer has the problem, because point B represents a successful resolution of the patient's problem, where effective diagnosis and treatment lead to improved health and well-being. Okay, a structured approach is critical. So that means we have to have a system, no? In guiding the clinician through the diagnostic process, ensuring that every step taken is purposeful and aimed at reaching point B efficiently and effectively. Okay, initial patient contact and information gathering. The diagnostic process starts as soon as you make contact with the patient, whether it's via phone or email. No? Gathering insights during this early interaction lays the foundation for effective diagnosis. In fact, if the patient calls you, or the way he sends his email will actually give you an idea already as to the pattern, no, or the possible constitutional weakness of the patient, or what it is that's bothering the patient. Continuous information gathering is vital throughout the diagnostic process. The practitioners must actively listen, observe, and document symptoms, behaviors, patient responses to form a clearer picture of the patient's condition. Okay, then as early as possible, you should already have formulated your diagnosis, or what we would call the diagnostic hypothesis. That means hindi ka pa sigurado, no? So formulating a diagnostic hypothesis early in the process allows practitioners to guide their investigation effectively. This hypothesis can be modified as you gather more information to ensure accurate diagnosis and treatment. Because most of the time, the patient will not volunteer giving you the information. You need to have a technique of being able to extract those information that you need, no? It requires timing. It requires considerable tact, because sometimes the patient may not want to open up to you, okay? So first, you have to be likable. You need to not be too overbearing, and you should not make the patient feel uncomfortable because you feel that you know everything, no? So it's like, because if you want the patient to be with you forever and expect referrals, so your patient should be able to trust you, no? Okay. Now, the importance of first impressions. See, first impressions are crucial, as they often reveal initial insights into a patient's condition that may not be immediately verbalized. Okay? You can actually figure this out as early as in the first two sessions, because if the patient doesn't come back to you anymore, so that means you were not probably a very good, or probably the patient didn't like your style at all, no? Or maybe the treatment was not really effective. Okay, so you, and do not promise the moon and the stars, no? Success doesn't happen overnight. So you have to be more realistic in your goals, no? Um, yeah, so you have to wait for the patient to really, like, for example, patient came to you with the pain, no? You need to be able to uh, evaluate or assess the intensity of the pain. So you may want to use 1 to 5, okay? So after the treatment, you may want to ask again, where are we now? Okay? So yung mga ganon. Okay, so they are formed, first impressions are formed from our intuitive assessments and can guide further inquiry while maintaining an openness to other diagnostic possibilities. Okay, so from the moment the patient stepped into your clinic or to your room, you need to already have something, um, you should already know what to do with the patient or probably what the patient has. Okay. And the kind of questions that you will ask should be very relevant. Don't ask too many questions because, especially if the patient is so deficient, that will deplete a lot of his energy. Okay. So then you have to maintain flexibility in diagnosis. Um, Whatever your initial impression is, you should trust it, no? And you need to remain open to new insights. So if you're not really sure, you may probably want to ask your colleagues, no? Hmm. Always compare notes and avoid fixation on one diagnosis. Okay? If possible, nga, you should have at least two or three, no? And continuously verify diagnostic hypothesis. Now, let's share with you the structured approach to diagnosis. So, this is a systematic method to ensure a comprehensive understanding of the patient's condition and facilitates effective treatment. Okay. Okay. Initiation of diagnosis. Commence the diagnostic process from the first patient contact. Okay. Pagkakita mo pa lang sa mukha, alam mo na. Or probably when, example, if the appointment was made through a call, no, you should already figure out there should be already something brewing, no, in your brain, in your mind. Gathering initial information and forming a preliminary hypothesis. Okay. Sometimes from the voice you can already tell what is bothering the patient, no, because especially if the patient is in grief, it is so difficult to mask it, no. Yeah. And I think just by listening to the webinar kanina, you already knew that grief can actually affect not only the heart and lungs, but also the liver as well, right? Then information gathering. Utilize structured intake sheets. So I presume all of us have intake forms, no? To collect detailed patient history and symptoms, ensuring that no vital information is overlooked. Okay. Then continuously verify initial assumptions against emerging data while remaining flexible to adapt the diagnosis as new information arises. Now, this one is the most, shall we say, uh, the final part. You have to evaluate and discern various symptoms, identifying contradictions and interconnections among them to find coherent patterns. So the ability to really find out the pattern, no? And mind you, I tell you, it's usually mixed. Kaya you should be familiar with the 5 uh, mixed patterns, no? Okay, final assessment and treatment planning conclude the diagnostic journey by synthesizing all gathered information into a holistic treatment plan tailored to the patient's unique needs. So, what does this mean? If you have a patient who is having metabolic syndrome or probably has early signs of diabetes, um, he is not similar to other patient with the same problem. Okay, because a patient is unique. Hindi siya pare-pareho. Okay? So, what are the challenges with complex patients? So, this is what I was um, talking about earlier, no? So, understanding the intricacies involved in diagnosing patients with multiple and conflicting symptoms is crucial for effective treatment. Okay. Patients often present with a myriad of symptoms that contradict each other. So this requires deep analysis, no? To understand the underlying issues. This is the most challenging part. Okay, next would be multiple patterns. You have not one or two, you have multiple patterns. Chronic conditions usually, no? Mga deficiency conditions. They may involve several patterns of imbalance simultaneously, complicating the diagnostic process. Practitioners must carefully distinguish between relevant signs and symptoms to avoid misdiagnosis and ensure appropriate treatment strategies. Okay. So effective communication during diagnosis is paramount, no? So practitioners must ensure that the conversation flows smoothly. There should be no dead air, okay? Guiding the patient through the diagnostic process. And the most important thing here, your patient should feel very comfortable, okay? This involves asking open-ended questions. And I think you know what this means, no? So open-ended means this can make the patient continually tell you more things, no? And this may lead to other questions. Actively listening and maintaining control of the dialogue to gather relevant information effectively. So you should be in control. And if it is the patient who is in control, so that means that patient probably has an issue, no? Usually liver G stagnation. So patients may sometimes take control of the conversation, sharing extensive information, or sometimes the patient may not be able to filter the data, no, that he would present to you, or veering off topic. Practitioners need to interpret their responses carefully. In fact, if the patient tends to veer off topic, that is also a pattern, no? So discerning relevant details amidst potential distractions or irrelevant information. Okay, so thank you very much.